Hey everyone, it's Razmeen here and welcome back to my channel. Studying for the NCLEX can feel like you're trying to drink from a fire hose, right? Trust me, I've been there. That's why I'm breaking down one of the most important topics you'll encounter on your exam, HIV/AIDS. We're going to cover everything you absolutely need to know to feel confident and prepared on exam day. Now I know this can be a heavy topic, but it's crucial for nurses to have a strong understanding of HIV/AIDS. We play a vital role in educating patients, providing compassionate care, and advocating for their needs. So, whether you're just starting your NCLEX prep or need a quick refresher, this video is for you. We'll dive into the nitty-gritty of HIV/AIDS, from the basics of transmission and stages, to specific nursing considerations and life-saving treatments. Remember, knowledge is power, and by equipping yourself with the right information, you can make a real difference in the lives of your future patients. So, let's get started. Before we dive into the specifics, let's make sure we're all on the same page. HIV, or the human immunodeficiency virus, is a virus that specifically targets the immune system. You see, our immune system is like our body's personal security guard, fighting off infections and keeping us healthy. HIV attacks a specific type of white blood cell called CD4 cells, which are crucial players in the immune system's defense team. As HIV replicates, it weakens the immune system, making it harder for the body to fight off even minor infections. When the CD4 cell count drops below a critical level, that's 200 cells per cubic millimeter of blood, or when certain opportunistic infections develop, we call it acquired immunodeficiency syndrome, or AIDS. Now let's talk about how HIV is transmitted. This is so important, not just for the NCLEX, but for educating your future patients. HIV spreads through certain bodily fluids, specifically blood, semen, vaginal fluids, and breast milk. It's also possible for the virus to be transmitted from a mother to her baby during pregnancy, childbirth, or breastfeeding, which we call perinatal transmission. It's crucial to remember that HIV is not spread through casual contact. You can't get it from hugging, shaking hands, sharing utensils, or even using the same toilet seat. Understanding these modes of transmission is essential for providing accurate information and dispelling harmful myths. Understanding the different stages of HIV infection is key to providing appropriate care and treatment. Initially, within 2 to 4 weeks of exposure, people may experience flu-like symptoms such as fever, sore throat, rash, and fatigue. This is called stage 1, the acute infection stage. Following this, the virus enters stage 2, a period of latency where a person might not experience any symptoms at all. This stage can last for years, even a decade or more, but the virus is still active and can be transmitted. Finally, if left untreated, HIV progresses to stage 3, AIDS. This is characterized by a severely weakened immune system, a CD4 count below 200, and the development of opportunistic infections. Lab tests play a vital role in diagnosing and monitoring HIV infection. The CD4 count, which measures those crucial immune cells, is a key indicator of immune function. A normal CD4 count is considered to be above 500 cells per cubic millimeter. A count below 200 cells per cubic millimeter is one of the criteria for an AIDS diagnosis. Another important test is the viral load, which measures the amount of HIV in the blood. A high viral load indicates active replication of the virus. To confirm an HIV diagnosis, we use a combination of tests, typically starting with an ELISA test followed by a Western blot if the ELISA is positive. In some cases, a PCR test may be used to detect HIV RNA early in the course of infection. While HIV can manifest differently in individuals, there are some common signs and symptoms to be aware of. Keep in mind that many of these symptoms can also be caused by other conditions, so it's essential to consider HIV as a possibility, especially in at-risk individuals. Some common symptoms include persistent fatigue, unexplained weight loss, night sweats, chronic diarrhea, recurring fever, swollen lymph nodes, oral thrush, and the development of opportunistic infections like pneumonia or certain cancers. The good news is that HIV is treatable. Antiretroviral therapy, or ART, is a game changer. It's a combination of medications that work together to suppress the virus, prevent it from damaging the immune system, and halt the progression to AIDS. ART needs to be taken consistently as prescribed every single day. It's a lifelong commitment, but it's the key to living a longer, healthier life with HIV. There are different classes of ART medications, each targeting a specific stage of the virus's life cycle. These include NRTIs, NNRTIs, PIs, integrase inhibitors, and entry inhibitors. As nurses, we play a crucial role in the care of individuals living with HIV/AIDS. We need to be prepared to provide holistic care that addresses their physical, emotional, and psychosocial needs. One of our primary responsibilities is monitoring our patients' lab results, including their CD4 count and viral load, to assess treatment effectiveness. We also need to be vigilant in preventing opportunistic infections, which can be life-threatening in individuals with compromised immune systems. This includes promoting good hygiene, hand washing, and safe food handling practices. Equally important is providing emotional support and education to our patients and their families. We need to be compassionate listeners, address their fears and concerns, and empower them to take an active role in their health care. Alright, let's talk about opportunistic infections. Remember, when the immune system is weakened, it's easier for infections to take hold and spread. You'll definitely want to be familiar with these for your NCLEX. Some common opportunistic infections associated with HIV/AIDS include pneumocystis, girovecii pneumonia, PJP, Kaposi sarcoma, a type of cancer that causes lesions on the skin and internal organs, oral candidiasis, thrush, tuberculosis, TB, and toxoplasmosis, a parasitic infection. Now let's wrap up with some essential NCLEX tips and tricks related to HIV/AIDS care. Remember, safety is paramount. Always wear gloves when handling blood or bodily fluids from any patient, and use airborne precautions for patients with suspected or confirmed TB. One of the most important things you can emphasize to your patients is the importance of RT adherence. Skipping even a few doses can lead to drug resistance, making the virus more difficult to treat. Annual TB screening is crucial for all HIV-positive individuals. That was a lot of information, but you did it. You're one step closer to conquering the NCLEX. Remember, knowledge is power, and by understanding HIV/AIDS, you're better equipped to provide compassionate and effective care to your future patients. Thanks for watching. Remember, with HIV, protect and prevent. Encourage safe sex practices, regular testing, and knowing your status. And of course, good luck on your NCLEX-RN exam. I have no doubt you're going to be amazing nurses. Don't forget to hit that subscribe button and the notification bell so you don't miss out on any future NCLEX study tips and tricks. Until next time, stay healthy and keep on learning.